A child has a dedicated PVS team that consists of the cardiologist, the cath interventionalist, the cardiac surgery, and myself, the nurse practitioner. I'm able to talk to families about risk factors that the patient may have that might be key drivers in speeding up the PVS process, and also talk to them about the PVS diagnosis. So I'm able to break it down in simple terms, talk to them about how important pulmonary veins are, what they do, and kind of give them some expectations on their journey. Along with that, we have subspecialties that we work closely with, like GI, ORL, Pulmonary, and the PAC team that knows the uniqueness of our population to help better take care of your child.
The cardiologist is usually the first person to make the diagnosis and to help figure out exactly how severe the problem is and what we need to do about it. Interventional cardiologists are also cardiologists, so they're the ones who do those catheterizations. And our imaging cardiologists are the ones who do the CAT scans and those types of things. But every patient also just needs to be followed over time. The big difference with pulmonary vein stenosis compared to most of the other things we deal with as pediatric cardiologists is that even after successful surgery, often the problem is still very aggressive and the problem comes back because those cells that are growing too fast are still growing within the walls of the pulmonary vein. So one of the most important roles of the pediatric cardiologist, even after the surgery, is to follow patients very, very closely to see if there is any recurrence of the pulmonary vein disease, and then to help treat it.
It's critically important that the cardiovascular surgeon is involved from the very beginning. When these patients are discussed in our multidisciplinary conference, the surgeon, the catheterization doc, the primary cardiologist, and the clinical coordinator all discuss the cases, and we discuss the important aspects of the pulmonary vein disease. And with that, the surgeon can chime in on their expertise where they can provide the most benefit, as well as the catheterization doc, and we come up with a plan for each individual vein, not only for the short term, but the long term.
Collaboration is very important in taking care of this unique population. Collaborating with not just our local team, but also a lot of our collaboration is with patients that come from afar. And I think that really reassures families that they can stay home and they don't have to move to Boston, but they still can get good care from us being part of their care at Boston Children's.
Here at Boston Children's Hospital, we kind of took on this condition over 2 decades ago, really, to really start to understand why it's different than other diseases that pediatric cardiologists usually treat, mostly because of this cellular overactivity. And so we've put a lot of time and effort, really as a team here at Boston Children's, to figure out how to treat it. We have even a pulmonary vein program here at Boston Children's. It's all that expertise that we have here and just our long story of trying to treat pulmonary vein disease that makes this a place to come. The baby's going through a lot, but the parents are too. And so we really want to create a very supportive environment in order to just help people through what, quite honestly, can be a difficult treatment time.